let me acknowledge the council members that are here, and following me will be Dr. Persse, and then we'll go from there. Uh, uh, Mayor Pro Tem Dave Martin is President, Councilmember Jerry Davis, Councilmember Sally Alcorn, Councilmember David Robertson are here. And then, of course, from the city, uh, Chief Bunick, Head of OEM, Office of Emergency Management, Chief Aceveda, Chief Pena, um, and then Steve Williams, the Director of Public Health for the City of Houston, is also here. Let me just start off by saying the city is not shutting down. Let me say that again. The city is not shutting down. So I know there are a lot of things on social media. I tweeted something out this morning that social media can be good, but in a crisis like this, social media can uh, can can work against you. And so let me just say it as clearly as I can. The city of Houston is not shutting down. We are all engaging in social distancing. And so for where there are employees who can do their functions from at home, they're doing that online, teleconferencing, telephone. We're setting up appointments so that the business can continue. We're engaging in social distancing. We're not shaking hands, none of that. But the city is not shutting down. And then we look at the facts and information on a daily basis as we move forward. So let me just say that everybody can kind of take a collective breath, and then we will collectively we will get through this particular crisis. Um, about 1 hour ago, the City of Houston Health Department, the medical community, including members of the Texas Medical Center, opened the first of 4 city, county COVID-19 drive-through testing sites for high-risk systematic people. It is important to open this process first to the people on the front lines, protecting everyone else from this disease. And healthcare workers and public safety officials are the groups with the highest risk of exposure and potential to infect other people. We have directly informed members of those professions by sending the test site protocol and location information to fire and police chiefs, Harris County Medical Society, and CETRAC. The COVID-19 drive-through testing sites will expand Saturday, March 21st, to people 65 and older with symptoms including fever. So it will expand tomorrow, Saturday, to people 65 and older with symptoms including fever. And after Saturday, it will open to anyone meeting high-risk testing criteria. The Houston Health Department and Harris County Public Health will open 3 other sites in the coming days for people pre-identified at high risk and announce an online and phone-based screening process. 2 sites, for a total of 4 sites have been approved by FEMA for our area, 2 in Houston and 2 in Harris County. And the first one, of course, we're standing up today. The others should be operational next week. The health departments respectfully ask the news media to refrain from showing close images of the centers when they are operational to protect patients' privacy. And doing so may lead people to being identified and discourage symptomatic people from participating, furthering the spread of COVID-19 in the community. People simply showing up to a site will not be getting tested, so it's not about just showing up because you want to be tested. There is a protocol, and we ask people to follow that protocol. Although we understand the anxiety and community concern, please know not everyone needs a test, and that we have developed a process to identify people for whom testing is necessary. And as you know, it took a lot of work for us to get to this point today. Certainly want to thank our federal partners, and today we have Congresswoman Sheila Jackson Lee, Congressman Al Green that are also present. Want to thank all of our leaders on the federal level for working with us. Want to thank the county Judge Lena Hidalgo and Dr. Shaw, who you will be hearing from later. Certainly the City of Houston, its health departments, Dr. Persse and Stephen Williams, Director Williams, and others. I want to thank FEMA as a whole, our first responders, our hospitals, Texas Medical Center and our hospitals and their healthcare personnel. It's just a collective effort, and it's another reminder that if we work together, we can get through it. And before I forget, let me just make this announcement. Metro will be implementing measures to promote social distancing by blocking some of their seats. And beginning Monday, Metro will not be enforcing the collection of fares and allowing persons to enter from the rear of the bus to reduce interaction. So that will start taking place on Monday. I wanted to make that mention. Let me yield now, and let me bring up first Dr. Persse, who will be followed by Dr. Shaw, and then he will be followed by Bill McKeon. And I certainly want to thank all of the doctors, Bill McKean and others from the Texas Medical Center. And as you can see, it's all hands on deck, all hands on deck. And when we're all working together, there's no question that we will overcome this virus and move forward. I also want to thank our federal partners, because it's all of us working together, not just any one group, but all of us working. We're stronger when we're all doing that. And for the resources that have come and the resources that will be coming. And so let me start off first with Congressman Al Green, followed by Congressman Sheila Jackson-Lee. And let me thank everyone. This is a family affair and an extended family, and we're all having conversations and numerous conversations, all working for the greater good. I do want to recognize Councilmember Tiffany Thomas, who's here as well. Thank you for being here. And I want to give just special acknowledgments to our first responders represented today by Chief Acevedo with HPD, Chief Pena with HFD, George Buning with the Office of Emergency Management, Steve Williams with our Health Department, all of our, Mark Eichenbaum working with our homeless population, Andy Eakin, Chief Economic Development Officer, because it's a holistic approach, and we know that we have to do everything we can to slow the progression, to blunt the progression, because we don't want to overwhelm our healthcare delivery system. And so we're all working hand in hand. So let me repeat, the city is not shutting down. The city and everybody else, city, county, we are being strategic, okay? We're not shutting down, we're being strategic. And we're making some very measured, methodical decisions as we move forward. And just to show you just how much we're working together, just today, the city of Houston partnered with Home Depot to secure additional emergency items for our healthcare workers and first responders. We have a long-standing relationship with the Home Depot. And not only do they provide jobs for many of our citizens, but they also support communities throughout Houston during times of crisis and natural disasters. And we appreciate the Home Depot and other essential retailers throughout the state who are doing all they can to provide the urgent products we all need, whether that's hot water heaters, refrigerators, or electrical and plumbing repair needs. And we also appreciate the Home Depot for expanding paid time off for their hourly associates who work full-time or part-time in response to COVID-19. And during these uncertain times, we are grateful for companies who are doing the right thing and supporting our citizens so that they can protect their health and those around them. Again, I want to also thank our retailers, and also Scott McClellan earlier. I don't know if Scott is still here, because they've made it clear stores are not shutting down. The food supply chain is fine, and so you don't have to rush to the grocery stores. And that's why I want to emphasize again, we're not shutting down, so people don't have to go rushing, thinking that you're going to have to go and buy supplies that will last you, 2 to 3 weeks. So we're not doing that. So again, get your information from credible sources. That's very important. Social media is good for saying hello. It's good for that. But when it comes to a healthcare crisis, these are your trusted partners, okay? We have the medical community, the medical center, the largest, finest in the world. I think we can trust them. Dr. Shaw, Dr. Persse, I think we can trust them. Our federal leaders, I think we can trust them. And all of our first responders, the council members, Mayor Pro Tem Martin, and all of the other council members, let me thank you all for your incredible leadership. So social media is fine. We're saying hello. And today is my birthday. It's not my birthday, but I'm just saying, But the point is, but when it comes down to determining whether the city is going to close or shut down, there are really only three people, really as it relates to Texas, that can make those decisions. That's the mayor, the county judge, or the governor. And if you don't hear from one of us three, then you have not heard it. And so but we're going to be measured, we're going to be prudent, we're going to take the necessary steps that we need to take in order to slow the progression. So I think that's it. If there are any particular questions to any of these individuals, we'll take those at this time. Well, just like the coronavirus is not discriminating, neither are we. Okay? Yep. So if people are experiencing symptoms, and I said people, that are living in our city, in our county, then they need to call or go to the website that will be given, and then go through the regular process.
Does the supply problem with personal protection equipment and testing gear pose a risk of closing the testing sites down the road?
Well, we're hoping not. And we're hoping that we will continue to get the PPEs that we need. And at this point in time, if Chief Bunin can correct me, but I think we have all of the PPEs that we need for the 4 sites. We're making sure that we have additional equipment and things that are needed for our first responders and everyone else. So, but I think we have what we need in terms of PPEs to set up now to stand up all 4 sites.
Okay.
Just based on the facts and the medical advice that we are given, we'll entertain whatever is best to make sure that we maintain the health and safety of the people in our region, and to make sure that our healthcare delivery system is not overwhelmed. But we'll take it one step at a time. We always look at all different scenarios. But where we are today, we are not shutting down. We're simply being strategic.
And are you and the county judge on the same page about this as far as you're concerned?
We are partners. I would say we are arm in arm, but that would be against social distancing. So let's just say that we are walking we are in step together, okay? And I talked with her not too long ago, about an hour ago, about a number of different things. We've been partners on this matter since the beginning, and we're partners now. We'll be partners as we move forward. These are not tough decisions for any of us. And I think what we are trying to demonstrate to the public today is all hands on deck, and we are all working together in the best interest of the people in our region. But they are very difficult decisions. And I think it's only natural. You'll have good conversations, but in the end, there only is one question: is what's in the best interest of the people that we represent. So I have enjoyed my partnership with her. I think she would say she's enjoyed her partnership with me. And, we just can't go to a restaurant right now, but, I started to say something else, but that, you can't get a drink. But no, things, we're moving forward. So no shutdown, just simply being strategic. Get your information from credible sources. And let me just say, and I think that they will all agree, because there's more testing, the numbers will go up. So let me just deal with that expectation. Okay, the numbers will go up. As you do more testing, the numbers will go up. That should be expected, but we're dealing with it. And then lastly, one of my council members asked me to make sure that I emphasize this, and that is, even while we're dealing with the coronavirus, COVID-19, please fill out your census. Please fill out the census. Because when we are talking about grants and research dollars and dollars to our medical centers, hospitals, healthcare delivery system, colleges, universities, transportation, the census is very important. And so in Houston, we can do more than one thing at one time. So as we engage in social distancing as it relates to this virus, we can also take the time while we are at home and online, okay? Just go online to the census and fill out those 9 questions and send them back and be done. So you're at home, take care of the census. Okay, so let's do that.